Good morning. It's June 3rd, and this is your daily brief in science. Here's everything you need to know. A new contender in the fight against biological aging is on the horizon. Telomir-1, developed by Telomir Pharmaceuticals, is a small molecule designed to elongate telomeres, potentially addressing age-related diseases and rare conditions such as Werner's syndrome, Wilson's disease, progeria, and dysphonia. Telomir Pharmaceuticals has reported significant preclinical successes with other candidates targeting age-related macular degeneration, type 2 diabetes, aggressive prostate cancer, and multi-drug-resistant infections. CEO Erez Aminov emphasized the promise of Telomir-1 in tackling aging-related diseases at their source, while Chief Scientific Advisor Dr. Angel highlighted its broad potential across various medical indications. The company plans to submit an investigational new drug application for Telomir-1 by the end of 2025, with human dosing expected to start in the first half of 2026. They're also preparing to meet with the FDA to discuss novel clinical endpoints for their rare disease programs, which could accelerate development timelines. In addition to Telomir-1, Telomir Pharmaceuticals is advancing Telomir-AG2, a drug candidate aimed at combating multi-drug-resistant bacteria, including MRSA. Preclinical studies have shown that Telomir-1 can reduce tumor growth by approximately 50% in prostate cancer models, addressing safety concerns associated with telomere-elongating drugs. Furthermore, Telomir-1 is under investigation for its potential effects on autism spectrum disorder, focusing on the interplay of telomere biology, oxidative stress, and neuroinflammation. To explore strategic partnerships and licensing opportunities, Telomir Pharmaceuticals will participate in the BIO International Convention 2025 in Boston from June 16th to 19th. However, the company has cautioned that all forward-looking statements regarding Telomir-1's development and commercialization are subject to risks and uncertainties, as detailed in its annual report filed with the SEC. A new study from Weill Cornell Medicine and Memorial Sloan Kettering Cancer Center has provided significant insights into the evolution of cancer during metastasis. This research, the largest of its kind, analyzed a total of 8,171 tumor samples from 3,732 cancer patients, focusing on the genetic profiles of both primary and metastatic tumors from the same individuals. Led by Dr. Luke Morris, Dr. Shi Kathy Zhou, and Dr. Chaitanya Bandlamudi, the study employed a proprietary tumor sequencing test to compare the genetic profiles of primary tumors and their metastatic counterparts. The findings, published in Nature Genetics, reveal that metastatic tumors accumulate more copy number alterations, or CNAs, than mutations. Notably, genome doubling was identified as the most common genetic event during metastasis, occurring in nearly one-third of patients. Interestingly, among patients who did not exhibit whole genome duplication in their primary tumors, 28.5% showed it in their metastatic sites, indicating its emergence de novo during the metastatic process. Dr. Bandlamudi explained that cancer cells evolve during metastasis by maximizing CNAs while minimizing mutations that could provoke an immune reaction. Dr. Karina Zhao, the study's first author, highlighted that whole genome duplication allows cancer cells to create additional gene copies, enhancing their adaptability and resistance to treatments. The study also found that patients with tumors exhibiting higher CNAs tend to have poorer survival rates and reduced responses to immunotherapy, pointing to the need for alternative treatment strategies for metastatic cancer. The researchers recommend targeting genetic instability or altering the tumor microenvironment as potentially more effective treatments for metastatic tumors. Understanding the genomic differences between primary and metastatic tumors is essential for clinical care, particularly in guiding immunotherapy decisions based on biomarkers like CNAs and tumor mutational burden. This study provides a clearer picture of the alterations that are more common in metastases, contrasting with prior studies that often involve different patients. Researchers at Washington State University have made a remarkable breakthrough by successfully recreating Egyptian blue, the world's oldest synthetic pigment, which dates back approximately 5,000 years. This pigment was first developed during Egypt's 4th dynasty, around 2613 to 2494 BCE. but the knowledge of how to produce it was lost by the Renaissance. The research team formulated 12 different pigment recipes using a combination of materials including silicon dioxide, copper, calcium, and sodium carbonate, heating them to around 1,000 degrees Celsius for varying durations. Their findings, published in NPJ Heritage Science, were achieved in collaboration with the Carnegie Museum of Natural History and the Smithsonian's Museum Conservation Institute. Analysis from the study revealed that to achieve the deepest blue color, only about 50% of the blue components are necessary, indicating that variability in the mixture can still produce a vivid hue. The pigment was also found to be heterogeneous, meaning that differences in production processes can lead to significant variations in quality and color. Currently, the recreated samples are on display at the Carnegie Museum of Natural History in Pittsburgh, within a new gallery dedicated to ancient Egypt. These findings are intended to aid in the conservation of historic relics, ensuring that restorations remain as accurate and vibrant as possible. Interest in Egyptian blue has surged, thanks to its unique optical, magnetic, and biological properties, which show promise for modern applications such as fingerprinting and counterfeit-proof inks. Historically, Egyptian blue was prized as a more affordable alternative to precious minerals like turquoise and lapis lazuli, and it was widely used in various art forms, including paintings on wood and stone. What began as a casual effort to create materials for museum displays has evolved into a significant project, reflecting a growing fascination with the pigment. John McCloy, the first author and director of WSU's School of Mechanical and Materials Engineering, highlights how modern science plays a crucial role in uncovering the stories behind ancient Egyptian artifacts. Researchers at North Carolina State University have unveiled a groundbreaking innovation in autonomous structures known as metashells. These unique devices can jump on a predetermined schedule, operating independently of external stimuli. The metashells are made from polyethylene terephthalate, or PET, arranged in a complex lattice that optimizes energy storage and release for their jumping mechanism. The jumping action is triggered when a load is applied, causing the metashell to deform. Once the load is removed, it gradually returns to its original shape before suddenly leaping into the air. This precision allows for jumps to be scheduled anywhere from 3 seconds to 58 hours in advance, which opens up various possibilities for their use. Tests have confirmed that metashells can effectively jump on multiple surfaces, including solid ground, sand, snow, and even water, functioning in temperatures as low as -15 degrees Celsius. Notably, these structures can carry cargo such as seeds, which they disperse upon jumping, effectively mimicking natural seed dispersal mechanisms. In practical applications, a single metashell can uniformly disperse seeds over a distance of 1.5 meters, making them particularly suitable for agricultural use. Future research aims to explore biodegradable materials for this technology and potential collaborations to expand its applications. The findings were published in the Proceedings of the National Academy of Sciences on June 2, 2025, and a patent for the invention has been filed. This research, supported by the National Science Foundation, marks a significant advancement in robotic structures inspired by natural mechanisms. Researchers have made a groundbreaking discovery that rewrites the history of avian nesting in the Arctic. Fossil analysis in northern Alaska has revealed the first evidence of early birds nesting there during the Cretaceous period, dating back at least 73 million years. This study, published in the journal Science, highlights the Arctic's role as a nursery for modern birds, challenging the long-held belief that birds began nesting in the region around 46 million years ago. The research was a collaborative effort involving multiple universities and institutions, showcasing the collective nature of this important paleontological study. Key contributors included Princeton University doctoral student Lauren Wilson, who identified various bird fossils, including those resembling modern ducks and geese, during her research in Alaska. The fossils were excavated from the Prince Creek Formation along the Colville River on Alaska's North Slope, an area known for its rich deposits of dinosaur and bird fossils. The findings include fossils from 3 main groups of extinct birds: Hesperorniths, Ichthyorniths, and species akin to modern ducks. The absence of enantiornithine fossils suggests that the ancestors of modern birds had an evolutionary advantage. Notably, some of the identified fossils were confirmed to be late-term embryos or hatchlings, indicating that birds played a significant role in the Arctic ecosystem even 73 million years ago. Finding baby bird bones from the Cretaceous period is exceptionally rare, making these discoveries particularly valuable due to the fragile nature of bird bones. The study emphasizes that high-latitude communities, including birds, have been integral to Earth's history, rather than a recent phenomenon, according to paleontologist Steve Broussat. Researchers also noted the ecological challenges faced by early birds, including harsh climatic conditions and predation from contemporary dinosaurs. Patrick Druckenmiller from the University of Alaska Museum of the North highlighted the historical significance of bird migrations in the Arctic, which date back 73 million years. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.